everyone, this is Chadi Alraies from SCAI 2024. I'm really privileged to be with Dr. Sinda Hidri. She's a resident applying for cardiology, but also she has a great presentation, a few presentations at SCAI Scientific Session in Long Beach. Sinda, thanks for being with us.
Hi, Dr. Chadi.
So, Sinda, you have a nice presentation. We got our attention, which is the outcome of patient undergoing cabbage with schizophrenia. So, tell us about the background.
So basically, we looked at the data that studies cabbage in patients with schizophrenia, and there was little known. Basically, there was only one study done in Finland before that studied cabbage in schizophrenia patient. A little reminder that those patients have smoke more, have more diabetes mellitus, they have more CID definitely. Those patients have higher mortality compared to the average population, and this mortality comes from the cardiovascular risk. They have actually higher cardiovascular risk.
And do you think the they are higher risk factor because they are not compliant with the medication?
That's probably coming from the fact that they're not complying from the medication. Some of the medication is associated with metabolic syndrome side effects. And we run the data. It's a national inpatient study. So we took all the cabbage hospitalization from 2016 to 2020, and then we took the patient with schizophrenia who were admitted for cabbage. We run the data, and it shows that patient with schizophrenia, they had similar outcomes to the other patient, the non-schizophrenic patient, except for the inpatient mortality, which was high. And it was significantly high, they had twice the inpatient, higher inpatient mortality.
Wow. Yeah. Okay, so the pure mortality difference. Inpatient. Yeah. And this is a matched cohort of patients?
Definitely, yes.
Okay. And any other outcome that was worse or compared to other?
Basically, we tested a cardiogenic shock, ACS, vascular complications. Most of the outcomes were similar actually between both populations.
So that's good study, and it's hypothesis generating. So do you think was the explanation? I know it's hard to predict, but what would be the kind of reasonable explanation?
Yeah. So mainly, I think the inherent risk of this, the fact these patients have higher cardiovascular risk. That's maybe a hypothesis that we need to study. I think also we need to focus for this patient on the primary prevention mainly, and the secondary prevention before getting to surgery and to cardiac events, and then.
So basically, they are sicker coming to the cabbage, and then cabbage
exactly
they tip them over. Is there data for heart failure, comparing heart failure before for both groups that were comparable?
I'm not aware of any data comparing.
Okay. Yeah. Well, that's again great study. Again, looking into a different angle of outcome revascularization in patients with schizophrenic disease, which is alert us to primary prevention. Thank you so much, Sinda, for your time. And congratulations for presentation at SCAI. Watch these videos and others at SCAI TV. It's Chadi Alraies from Long Beach. Thank you.